Ankylosing spondylitis is an inflammatory arthritis. So it's an inflammation that can attack different joints in the body, the spine, the hips, the knees. It can also attack parts of the eye and parts of the bowel. So you can have a variety of symptoms, and it tends to occur in patients in their teenage years and up until their 40s as the first time when they get signs and symptoms of ankylosing spondylitis. Ankylosing spondylitis is an autoimmune disease. So it's theorized to be something that occurs after an infection, where the body might attack an infecting organism. It then recognizes different parts of the joints as similar to that infecting organism and attacks those joint surfaces. Ankylosing spondylitis primarily affects large joints in the body, particularly where there are a lot of ligament attachments to bone, like in the joints between the pelvis and the spine, the sacroiliac joints here. There are really strong ligaments here that attach between the iliac bone and the sacrum bone, and those ligaments and those attachments to those ligaments can become inflamed as the immune system attacks the attachment. And that inflammation and pain induced by the inflammatory response can present to a patient like a low back problem, a backache, and as the disease progresses, the pain can become more chronic, it can become more persistent, it can become more severe, and then things can get to a point where pain starts to recede and the joints start to ossify or calcify and fuse together. And then at the very end of the disease, you can have very little joint pain, but now you have a joint that doesn't move anymore. So in the case of the spine, you don't want to fuse in a position where you're crooked or bent forward or your head isn't in a good posture. And so later chronic manifestations of the disease involve fusion of the spine, but it's optimal for you to have good posture if that is to occur. Patients that have ankylosing spondylitis can still live full and vibrant lives and do all the activities that they want to do. But what they should know is that it's best if they try to lead the lifestyle that's as healthy as possible, because the treatment, which can include just the physical therapy, stretching, or medications, might prevent the disease from becoming a more chronic and severe manifestation of ankylosing spondylitis.